All right, this is the third time I have done Botox, and this will be Mindy's second time. Peace, love, and happiness. We are so excited. And we are just pulling up right now, so we're gonna give you guys a quick tour again. I know we've shown you the office before. This is Dr. Portela with Treasure Valley Dermatology here in the Meridian, Idaho area. And I don't know what it is, so I'll be honest, throw it on, but it will get big, and then I'll go like this, and then it knocks it, and then it will just continue to bleed.
Okay, let's take a look. So I'm gonna shine a bright light on you here.
Yeah.
Okay. So it doesn't look like a skin cancer. It's most likely something called a fibrous papule. They're really common on the nose. It's a little overgrowth with the collagen of the skin there, and they get extra blood vessels on them, and so they're fragile, they traumatize easily, and they bleed a lot. Typically, if we just numb it up a little bit, it's a needle poke in the nose, it's not fun, but then we can shave it off, cauterize it, and it heals almost imperceptibly, very minimal scarring. So,
Okay.
so and there's another one.
Yep, we got a few more here. So these I've had just forever.
Okay.
And they don't bother me until I like nick it on something, like if I were to wear like a taller shirt.
Okay.
It just kind of is buggy, so if we could just go ahead and get rid of those two, that would be
same thing.
fabulous.
Numb them up, just kind of snip them off.
Okay.
So.
Let's do it.
All right. And then about the number of units that we've done in the past for Botox.
Yep. Okay.
Sounds good. We'll start to prep everything. So.
This is all the information on Juvo that we are getting today. Pretty good before and after. We're excited for our after.
Raise up high. And relax. Raise up high. And relax. Raise up high. One more time.
Mindy's little mark right here. What was that under her nose again, and what causes it?
So it looks like a fibrous papule, and those are just kind of bad luck. There's no rhyme to reason. Some people seem to be more prone to them than others. They're not harmful, but they do get confused for skin cancer sometimes.
I'm excited to see it go.
Nice deep breath in. Let it out. And a little pinch on 3. 1, 2, 3, pinch. You're doing great. Good. Keep breathing in.
Wow. It went right up into my eyes and ears.
Okay. We're going to test you now. You feel anything sharp?
Mm-mm.
Great. Let me get the ones on the neck numbed up while the numb sits in. All 3 of these?
Yeah.
Okay. Pinch. Pinch. And a pinch. Okay, the worst is over.
Yeah, not too bad.
I'm feeling something in a lot of these.
I was like right in my eye.
Okay, so we're doing a shave removal here. Just a sharp little razor blade. It's off.
Sweet.
And then we do just a touch of cautery so that it doesn't come back.
Oh, interesting.
That is so cool.
I can smell it.
It's a bad place to have that because it does smell bad. And the only blood spot is from where I poked you with the needle, so that'll stop in just a minute.
So what are you doing? What is that machine?
It's that electrocautery, so it uses a little electric arc, electricity to stop bleeding essentially.
That's awesome. Is that pretty awesome? Yeah.
So your friend is gone.
It's okay. These guys. You were saying you send it to the labs. something, if you just want to maybe explain that.
And so when a biopsy sample is taken, maybe hold that right there for a second. We send it off to the lab where they process it, put it on a microscope slide, look at it under the microscope to render a diagnosis, because the way things look to the naked eye sometimes are different than the way they look under the microscope. And occasionally we get surprised that something that looked very normal ended up being a skin cancer. Usually the diagnosis is pretty similar to what we anticipate, but it's always good to have it checked so that there's no, you don't miss something. Feel anything sharp there?
And what do you want to look for if you're worried about skin cancer?
The most common type of skin cancer is a basal cell carcinoma. And that often looks like a pimple that never heals, that doesn't want to go away.
What about like the color?
So for basal cell, that usually looks just like a pink little fleshy bump. Melanoma is the one that everybody worries about, and that often looks like a mole that has gone very dark, or changes in size, it gets bigger, has an irregular border. Those are the types of things that we get a little bit concerned about.
Okay. How you doing? Great, I don't feel anything.
And then rather than the cautery on these ones, we're using a little liquid that stops bleeding. It's something that we use for chemical peels called TCA, but it helps to feather in the edges of the scar, make it look a little better, and stops bleeding really well.
How many did I have there?
3.
Are they pretty big or?
There was one big one, comparatively, and then 2 that were pretty small. So then
How often do you find that they're actually cancerous?
like in this setting where we don't anticipate that they're anything harmful, it's pretty uncommon that they'll end up being cancerous. But most of the biopsies that we do, there's question as to whether it could be good or bad. And occasionally they're bad, unfortunately.
What does insurance cover? What
So-
yeah.
Typically, the insurance is going to cover things that are deemed medically necessary. And so when a patient comes to us, we're seeing them for concerns about skin cancer or a rash, acne, things that are changes in the skin that are not normal. And so the other part of the practice is that we're doing cosmetic work. And so that's where somebody's concerned about something on their skin, but it's not deemed as a medically necessary service, and that is the Botox, the fillers. There's also, areas where we feel it should be more medically necessary, but we find insurance doesn't like to cover certain things. Patients really are bothered by skin tags. They're bothered by hair loss, and most of the time insurance finds that that's largely cosmetic because it's unlikely that those are ever going to be life-threatening. And so if it's a medically necessary service, then insurance will cover that generally, and it's always frustrating in the age of high deductible health plans that although something may be covered, it still can cost a lot for a patient.
Okay, and do you know someone with like an FSA, HSA, if they come in just for Botox, is that something that they could definitely use?
That's kind of a gray area, and we've had patients that have been able to do that, but I think it depends on the company that administers the plan. In general, if we're asked to write a letter to to say that something's medically necessary, we don't endorse Botox as medically necessary if that's what's going to get something covered by an FSA, unless it were for like excess sweating, where we're going to be treating a medical condition rather than a cosmetic one.
Okay. I have a friend that reached out to me the other day that was asking about Botox for her jaw. She heard that she clenches her jaw at night and wakes up with a really sore, mouth and everything. Is that something that you could possibly use to relax the muscles in the jaw?
Yeah, so when you focus on that, the masseter muscle, the big bulky muscle that closes the jaw, Botox in there will help to relax that. And that's a treatment that's done, for medical reasons, and there's TMJ specialists that do that. We do that as well, and usually when it's requested of us, somebody's looking for a cosmetic reason. It's more a common request from Asian populations who are looking for a more Americanized, like slimmer face. And so treating the masseter muscle causes that muscle to decrease in size because you're not using it as strongly, and you're going to notice the face will slim a little bit. And the results are pretty dramatic with that. But it can be helpful for people with clenching.